CataractCoach.com. Great skills at case 700. This surgeon's journey up the learning curve is going very well. Great job here. Let's watch the surgery together. Good draping, by the way. Eye and primary. There's the paracentesis. Be careful, don't hit the lens capsule. There's the main incision. Very nicely done. Looks like a right-handed surgeon. And now putting in some viscoelastic, perhaps. And we're going to watch this video straight through. Let me tell you about Retina Rounds, our sister channel. I promise you're going to love it. I got to tell you about it every video because you haven't checked it out yet. You're waiting for me to give you a royal welcoming. This is it. This is your royal welcoming. Go check it out. I promise you'll love it. Now, here comes the viscoelastic. Maybe it looks like HPMC, hydroxypropyl methacellose. That's not an easy one to do rexes with. Yeah, that's HPMC for sure. See how it spreads out over the cornea? Because it's so dispersive, so thin, sometimes it's quite hard to make a rexus. But let's watch the technique here. Surgeon's going to measure out or poke in here. Let's see. There it is. And then grabbing with the forceps, and let's see that rexus. By the way, good draping, eye and primary. I like that. Good tear film. Not a lot of oily stuff in the tear film, which is great. And now pivot, 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 pivot. And should you make a rexus clockwise or counterclockwise? You know, it doesn't really matter. It's whatever your preference is, whatever makes you happy. But very nicely, coming around beautifully. Good control. Let's grab that. Don't let it get out too far. There we go. So that one spot got out a little bit, but that's okay. And now let's see what we got here. Time for some hydrodissection. So let's see the hydrodissection here. Going around the side here. Good. I like to do the hydrodissection as well on the left and right sides, but I don't like to typically go straight down the middle. Because the problem with going straight down the middle is, if you go down the middle, then you've got issues with what if the nucleus wants to come up like it just did here, and you're blocking it. Now, a little bit of a Bell's reflex from the patient, a little extra aliquot of viscoelastic, which is good. See, the patient here is not super comfortable. Maybe needs a little more systemic anesthesia, so the patient's trying to close the eyes. You get that Bell's reflex. But yeah, once you get two instruments in the eye, you control the eye movement now. Chopper in, phaco probe in, let's see. And chopper's going to go around the nucleus. There we go. Chop that thing. Not too dense of a cataract, which is good. Let's get that scope centered up a little bit. And then this thing wolfs down pretty easily. Again, nicely done there. And so nucleus comes down pretty fast. So that's the Beverly Hills cataract. Those are the ones I'm really good at. I like Beverly Hills. And so aspirating that nucleus down easily. Be careful with the epinuclear shell. Make sure the capsule does not come up as well. So good control there. I'd get that with the eye probe. For me, I'm more really cautious. Then that, of course, that piece you need to use the phaco probe for. Now coming out. Beautiful. Capture bag already looks pretty clean. Now we can just use the eye probe to clean that up. And so a little power wash. BSS power wash. That's a neat one too. That definitely works. Just be careful. Don't touch the capsule with the tip of the cannula. Because these cannulas, even though they're blunt, they can puncture the capsule. I promise you. I've seen it before. So now let's see what we got. We're going to put some eye probe in the eye, bimanual eye probe. Now if you're doing this bimanual eye probe with the infusion in the main incision, be aware that it doesn't really do a great job of sealing in that incision. Right? It's too big of an incision for too small of an instrument. So there you got a piece floating around. So get that aspirator. See how the AC is kind of not so well formed? So I would have preferred to have a second paracentesis here, but obviously this works. Be careful grabbing that lens of the cortex. Don't hit the capsule. And that looks pretty clean. I think you're pretty good. I wouldn't really sweat more than this. If you're done case 700, remember, you're a little bit past half the way up the learning curve. I think around Case 500 is pretty typically halfway up the learning curve for modern day phaco surgery. I think you can get about 90% of the curve if you've done about 2,000 cases. Now here comes the lens. Let's see what we got. So hydroimplantation. Left hand has the infusion. And then here comes the right hand putting the lens in. Get that thing delivered in the bag. All right. It looks like a single piece acrylic lens. And then get that thing unfolded. There we go. A little bit of iris prolapse there. Push that in gently. There we go. Get that lens opened up. Make sure it's completely within the capsular bag. So it's a very efficient case here. A nice clean 5-minute case. And you're at about case number 700. You're doing fantastic. My advice is slow your case down just a little bit. Aim to add a minute to your case. But by adding a minute, ask yourself, how can I make it even more perfect? So at this point, please do not focus on how fast can you go. Rather, how pretty can you make the case? How pretty can you make the incision? How pretty can you make the rexes? How beautifully controlled is it when you do your phaco chop or your nucleus removal? That's what I would focus on right now. You've got fantastic hands. This is a great job for case 700. I would love to see from you case 1,000, case 2,000, and I think you're going to be a world-class surgeon. So good job. Keep up the strong work here. Remember, you can send your video into Cataract Coach too. Now, I do prefer complication videos. They're much more fun to watch than routine cases. So go to CataractCoach.com, the actual website, not just YouTube, CataractCoach.com, and you can find the link to submit your video, and we will check it out. But remember, I do get about 50 videos a week. All right, thanks for watching. Remember, check out CataractCoach.com, the actual website, and of course, RetRounds.com, our sister channel with so much great learning.